Hello, welcome to Portfolio 1 and 2. This PowerPoint is just going to kind of go through what to expect when you go to clinicals and what we're looking for when you go through the clinicals. Okay. So Portfolio 1. Okay. Everybody's responsible. Make sure you do look at that clinical guidebook. I'll do a little overview of it at the end of this, but make sure you look at that clinical guidebook and read through that. It's got the objectives for each of the clinical locations that you're going to. You have to meet mandatory requirements for hours and competencies when we get to the end of clinicals here. So when we look at the hours, okay, this has been updated a little bit, but we dropped out these scenarios. So you're going to do 12 hours of respiratory and 64 hours of ER in the first in Portfolio 1, and then 4 hours of cardiac cath lab in Portfolio 1. In Portfolio 2, you're going to do 12 hours in the OR. That'll be done in 2 separate 6-hour shifts. 12 hours in the ICU. Could be 2 shifts, might be 1 shift, depending on where you go. Another 32 hours to 40 hours of ER. 6 hours in the NICU. Pediatrics, 6 hours. Labor and delivery, 6 hours. And then when we get to capstone and the field internship, you're going to do 180 hours in the ambulance and field internship and another 75-ish in the capstone. If a student is going to miss an experience, the student has to notify the clinical site directly, in addition to notifying me or Lance as your instructor. We will determine if that absence is going to be excused or unexcused. If you don't call in to the hospital, they may make it in an unexcused absence. Absence are counted, number of experiences missed, okay, the number of hours. So we will have to, anytime you miss a clinical, we will have to make it up at another time. You get 2 excused absences per semester. Make sure you arrive 10 to 15 minutes prior to the start of the clinical experience. Depending on where you're going, maybe you need 30 minutes because you want to make sure that you get enough time to either, if you're going to OR or cath lab, that you're getting there to get the scrubs on. If you're going to any of the other locations that don't need scrubs, just make sure you give yourself enough time to find the location you need to be there. Students late, agency has the right to send you home. So if you're late for a clinical, usually they're a little accepting outside of the field, but make sure that you give yourself adequate time to find the location in the hospital. Respect patient confidentiality at all times. Any paperwork is not going to have any personal identifiable information on it, and only document the non-PHI for your documentations. Whatever you do, do not share any patient information outside of the educational environment. We are still under the HIPAA rules, so make sure that you are not violating any of that. This one just basically says the state patient has the right to refuse to be treated by a student. Okay? It's not anything up against you guys. They just have that right to refuse treatment from students. And then the preceptors have the right to refuse to let you do certain type of skills, depending on what it is. Also, the only skills you're allowed to do in clinicals are ones that you've been signed off on in class. So make sure you are abiding by those decisions. And whatever you do, do not argue with a preceptor, ever. Case of an emergency, there are some college liability insurance that will cover you in case something happens while there. And then there is also student accident insurance. And this is something that is kind of a supplement onto your own insurance. So once yours hits and takes care of the bill, this will supplement onto that. If there's an injury or an illness or something that happens at a clinical, obviously administer first aid, refer the student to appropriate health care, get everything taken care of for the emergency, and then contact the instructor as soon as you can after that. Preceptors are usually pretty good about getting a hold of us if something happens. Some clinical sites might have specialized paperwork that they need you to do, which most of you have done with the health and safety training. But make sure that you keep up with that. It will have to be redone on the first of the year for Gunderson. Most of the other sites, once you've done it, it's good to go for the remainder of your coursework. Okay. Student conduct. Make sure that you're referring to the Western Student Handbook, Paramedic Student Reference Guide for everything there. There is some conduct information in the syllabus, so make sure you're paying attention to that information also. And then, of course, be mindful of the environment you're in. Respect patients' identities and respect the people you're working with at these clinical sites. I stated this once already, do not argue with a preceptor, especially in front of patients, but do not argue with a preceptor or a clinical site. You may need to be a little assertive when it comes to getting some of your clinicals completed, but make sure that you're not like arguing or saying, I have to do this. Just say, hey, these are the things I should be getting done while I'm here. And this is what I'm looking for, right? So talk with your preceptor, have a good conversation. Again, the objectives are in the clinical guidebook starting around page 20. So make sure that you're looking at those too, if they have questions. You can perform any tasks or assessments that the preceptor has directed you to do as long as it's not unsafe. So things like that might be some certain medications. They might let you administer medications. Generally, I recommend having a good idea as to what that medication is and what it's going to do to the patient before you give that. And if you need to, instruct or talk to the preceptor before giving that. Maintain a high level of professionalism, integrity, humility, all times. Again, that goes with wearing the correct uniform, being in the right place at the right time, using appropriate language. Don't show any like negative views or anything any views you have on the clinical site. Just be a professional while you're at that clinical, and things should go well. All electronic devices should be turned off during your clinical unless your preceptor approves you to use it for some reason. Okay. If there's sleeping quarters at that clinical site, generally students are not allowed in there unless you're invited. Okay. There are some areas of the hospital or the field clinical sites when you get there that may be inaccessible to students, so just stay away if there is something like that. You're not there to watch TV, you're there to learn, so make sure that you are studying or looking up information, medications, whatever it is you need to do to prepare yourself for the clinical. And then if participate with any duty requirements they have to, whether it's cleaning the room, setting the room back up for the next patient, stuff like that. If you're there over a mealtime, make sure that you either have money or brought your lunch. Generally, the preceptors will show you where you can go to eat and all that, and or find meals if needed. So follow the lead of the preceptor, make sure that you ask them, hey, what do we do for meals, or how long are we expected to kind of take if we take a break or something like that. So follow the lead of that preceptor and talk to them. If your preceptor goes into a patient, go with them, right? If they let you. Don't be selective about what patients you get. Just stick with that preceptor, stick to their hip unless they tell you to go somewhere else. Most locations will require you to wear your student uniform that we wear in class. Some may, like the OR and ICU or cath lab, might make you wear scrubs. That information, I'll show you where to find that in Blackboard, but some locations have scrubs, most have the uniform. Okay. Whenever possible, cover up any tattoos, minimal jewelry, okay, while you're in those locations. Keep your hair neat and clean, secured off the collar, away from your face, just like you would any other day at work. Just make sure that you're keeping that stuff out of reach. Beards, mustaches need to be cleaned and trimmed. Make sure you're able to get your N95 mask over them. Again, fingernails, stay neat and clean. Okay. Neutral, clear nail polish. No artificial nails. Okay. Tend to get in the way. Strong scents are not permitted. Cigarette smoke, bad breath, body odor are offensive to some patients, so make sure that you're trying to stay away from that stuff while at a clinical site. Yeah. EMS pants, polo shirt, Western polo, duty boots, again, with the exception of the cath lab and the OR, that's generally what you're going to wear. Your Western ID should be worn also at all times when you're on that field site. You may or may not have a student badge for doors, depending on the clinical site that you're going to. Some sites at Mayo and Gunderson require you to have a door badge card. Okay. Smoking is prohibited while you're on site at those clinical sites, so make sure you stay away from that and make sure you don't smell of that when returning from a break or something. Make sure when you're going to the clinicals that you bring your ID, name tag, pen, pencil, book, notepad, watch with a second hand, preferably your stethoscope, trauma shears, your clinical binder and paperwork, which is located in the classroom under the counter in where it says clinical paperwork, and then a pen light. By the time we reach the end of clinicals, you'll have to have all hours and competencies fulfilled in order to sit for the National Registry. Clinicals schedules are given to you generally prior to the semester starting. Some things may change as we go through it, but make sure that we are signing up or we get those in place before the semester starts. We do not trade any clinical experiences. If something happens, we need to switch something, make sure you contact me or Lance for those trades, or not trades, for switches. We understand life happens, but we do our best not to change anything once we get going. If you work at a clinical agency, do not gray that line. If they tell you, hey, I need you to do this, I'm a student today, I can't do that, right? The best way to do that is be in the correct uniform, right? So if you work there, don't gray the line. If you're a student, you're a student. If you're working, you're working. And then also make sure that you're not using a relative as your preceptor. A student that fails a clinical course may not continue the program, right? So it's rare that someone fails a clinical course. Generally, you have to do something like arguing with preceptors or doing something completely wrong that gets you a failing grade. It's rare, but don't be that person. Be professional, listen to your preceptors, show up on time, and generally you're going to get through the class. Right? Get your paperwork in on time. Right? If a clinical tends to run late, that's okay, but generally outside of the clinical times, we're not going when you're not scheduled. Right? So for grading, generally that's done by making sure that you have all your paperwork done, you've met with us, and we've done some site visits, talking to preceptors, turning in the evals. Everything is done in a timely manner, and we get that to the end of, before the end of the clinicals, the semester. We should have your EMT license already. CPR, health and safety training has to stay at current. We should have a copy of your training permit and completing any site-specific requirements for health and safety or paperwork. So there's a clinical evaluation of the student that your preceptor will do of you. It's on the paperwork that you should be filling out from class. And then there's the other documentation that goes with it. There's a preceptor evaluation of the student, a evaluation of the clinical site, and then a copy of the clinical log sheet, right? Those are the paperwork things that you're going to upload into Platinum Planner once you complete the training or complete the paperwork. Make sure that that clinical log sheet is signed by the preceptor. Okay. And then we also look at these professional behaviors, those 11 professional behaviors that we're grading you on in class and in clinicals. Okay. So clinical hours, you can look at the student minimum competency sheet, formerly known as the Appendix G. That has the clinical hours that are required, the experience log, and the evaluations, right? We're going to make sure that we upload all that information into Platinum Planner. Incomplete documentation will be returned to the student. If I find anything that's missing, I return it, or if you decide, hey, I forgot to do something, you can ask me to return something. Okay. I am the clinical coordinator. I oversee all the clinical courses. Generally, I'm your liaison between the preceptors and the college, and making sure that we're doing everything we need to for clinicals, right? Preceptors, there's someone who has agreed to take on a student. It has to be a paramedic, nurse, RT, or higher, right, to be your preceptor. Don't let some of these ER sites put you with an EMT, right? You have to be with a paramedic or higher level licensed personnel. Okay. So their jobs to maintain or facilitate a good educational experience, maintain a good educational environment, and make sure that you get what you need to out of your performance and evaluate you. Okay. Communicate with you, and then provide growth and giving you ability to do some of these skills. Right. Again, you have to complete the skill in class before doing it in a clinical site. And all skills have to be within your scope of practice. Okay. There is a potential that you could be exposed. Make sure you're wearing proper PPE for whatever setting you might be in so that we can reduce that. If there is a potential exposure, right, Make sure that you report it appropriately. Here, wear your N95 mask, pocket masks, needles, go in the sharps, and do what you can to minimize any exposure that you're going to do. So here's some of the different locations. In the guidebook is the objectives for the ER, ICU, NICU, OB, OR, Cath Lab, RT. Those are the different locations that we'll go to. Okay. Again, just be in the right place at the right time in the right uniform, bring some study materials, okay? Seek out opportunities, make sure they sign your paperwork, submit that paperwork in a timely manner, and make sure you have permission to leave before you do. Okay. So, questions. Next, I'm going to go into the paperwork here. So this first sheet here is the student log form. Yeah. Again, you can find these in the cupboard underneath the countertop in room 114 in Sparta. Basically, the top part, fill out the demographic, your name, what clinical site you're going to, what department it is in, date, time frame you got there, time frame you left, how long you were there, and then start your clinical, right? There should be 9 spots here for patients. You can put their age, gender, what age category it was, what kind of pathology or category that this patient fit in, whether it's a stroke, cardiac arrest, whatever. Pick the right pathology. Any skills that you might have done, airways management, anytime for airway management, anytime you assess the airway, put a nasal cannula on, non-rebreather, ET tube, whatever it might be, anything airway, you can check as an airway management. Okay. Here's ET tube, any intramuscular drugs, IO, IVs, okay. Meds you gave, NEBs you might have done. Okay. And then this ALS team member, team lead, you don't need to worry about that till we get to the field clinicals. Preceptor's initials on the end. Any comments you have here, right? You can take notes here or just take notes on a separate sheet of paper, that's fine. Get your student signature, preceptor signature, and then circle the paramedic, right? The next page is the paramedic clinical site, the clinical evaluation of the student. So your preceptor can fill this out and then go through and evaluate you as you went through that clinical. And then the other one is the student's evaluation of the clinical site. Here, you just go through and you evaluate the clinical site. Best thing about it, worst thing about it, what can be improved. Did staff know you were coming? Were they aware? They should all know you are coming. I do send out these schedules at the beginning of the semester to the hospitals, so everybody should know you're coming. So those 3 pieces of paperwork will be added and uploaded into Platinum Planner when you're done doing the paperwork. This next document here is the clinical guidebook, okay, for portfolio 1 and 2, which is all your hospital clinicals. And it basically goes more in depth into what that PowerPoint I just went through talked about. Okay? Everything you need to know in more depth is in this guidebook. And I will go to page 20. Okay. So when we get down here, page 20, right, is where it starts, and it has the objectives that you'll be doing at each department. So here, the emergency department is the first one, okay? And just go through, be able to do a patient assessment, airway management, oxygen, IVs, right? EKGs, all that fun stuff we can do in the ER. ICU, be pretty similar, but maybe a few more things. OB, okay. OB, you might just do observation, but patients might let you assist also. OR, primarily getting airways. The goal is to get at least 4 ET intubations, if not more, right? Cath lab will be primarily observation. Sometimes the doc will let you participate. RT, a lot of it will be vitals, listening to lung sounds, following that RT around. Okay. Maybe getting to see the use of some ventilators, CPAP, PEEP, BiPAP, any of those additional things that respiratory therapist works on. NICU, okay, again, doing what you can, helping with observation, assessments, vitals on the kiddos. Okay, that's kind of those objectives there. Okay. So that concludes the clinical guidebook and objectives, what we're going through with this, what you should expect for clinicals.